Hello, everyone. Welcome to Global Health Out Loud on This Week in Global Health. I am Dr. Sultan Bali, and with me is Dr. Jessica Taff.
Hello, everybody.
We will be discussing a very somber and grim topic, which is affecting the Middle East quite a bit this time. So we'll be talking about Syria.
More than 700 doctors and medical personnel have been killed in attacks on hospitals since the beginning of the conflict.
People in Syria have been suffering from years of war and death, with Islamic State leaving behind a deadly trail of destruction across the country, with corpses being left out to rot in the open. A flesh-eating disease is now spreading across the country.
Now, as you know, there has been conflict and civil war going on in Syria for about 5 years between those who oppose President Assad's regime and those who don't. On top of this, there have been jihadists from Islamic State that have been kind of causing a lot of problem in the area. So we'll be talking about how that has impacted health. And the conflict in the region has really changed the health landscape of the country, and not to mention to lead one of the biggest refugee crises in the recent history. Over the first 4 years of conflict, more than 75,000 civilians have died from injuries. There has been genocide, gender-based violence, and even as we speak, Yazidi women are sexually enslaved and subjected to rape and gender-based violence. While some have become direct targets of war, the other indirect targets due to blatant collapse of the health system in the country is quite substantial as well. So, Jess, we're obviously touching a very grim topic. Do you kind of want to talk about, what has been happening and, how the hospitals are being targeted in Syria?
I do, Sultan, and I'm really, really glad that we're talking about this topic today. Last month, I read this fantastic article from the New Yorker, and it published this piece describing how the conflict was demolishing the healthcare system in Syria and then the bravery of those that are actually trying to maintain it. So just to give everybody an idea of what's been going on, Physicians for Human Rights report that over 700 medical personnel have been assassinated, bombed, or tortured to death by the Syrian government over the past 5 years. That's incredible. I couldn't believe those numbers when I read it. And this is actually common practice. Targeting of health services and personnel or blocking access to it is a specific tactic used by the government in this war. It's actually a war tactic. Civilians that oppose the government are being targeted, and this extends even very, really sadly to pregnant women and children. And just to give an idea of how this is really affected the healthcare system, well, first of all, 95% of the physicians that used to be in Aleppo, which is the most populous city in Syria, have fled to other countries. And there was recent reports that the last pediatrician in the city was killed.
That is absolutely shocking. And, it is already a region that has very limited human resource capacity for health, and you're seeing these attacks. In fact, Jess, I was reading that according to a report by Physicians for Human Rights, they have documented 365 attacks on 259 medical facilities during the last 5 years of the Syrian conflict. Now, that's a blatant flouting of the Geneva Convention, and it's obviously impacting the health quite a bit. It's led to reemergence of many infectious diseases in the area. We've seen polio and measles come back. In fact, polio, to give an example, Syria had not seen polio since 1999 until it emerged again in July of 2013, paralyzing 36 people in the region. This is a disease that we've been kind of trying to eradicate for a very long time. And in fact, as per United Nations, over 900,000 kids in Syria are set to miss their vaccination shots. So it's an immense burden that's going to, it's an immense burden on the health systems, and it's going to impact the future generation of the country. So, Jess, I also kind of wanted to ask you, did you read anything, on what's being done to address this really grim scenario in terms of health in Syria?
Right. Well, that New Yorker article actually it highlighted some of the efforts that are going on. So you've got healthcare capacity in Syria being decimated. That's really what is happening. But there are those that are fighting to maintain a baseline capacity. And really, if only to just provide emergency surgical and trauma care. There are underground hospitals with ways to monitor patients through Skype. There are safe houses, and there are actually e-consults through mobile technology that are going on. And this is these are among the way that doctors and international NGOs are striving to provide medical care in the country.
Yeah, another way is obviously building the healthcare capacity by training new healthcare workers. And I remember reading that one doctor, David Knott, he is a British physician who was actually featured in the New Yorker article as well. He has been on the ground and is using mHealth and M technology to provide emergency medical care. So kind of using a version of telemedicine in a way. And the type of emergency care taught that he teaches, it focuses more on damage control. So focusing more on stopping bleeding, preventing sepsis first, obviously even first aid, and only to return the patient to surgery when he or she can handle it or will have a strong chance to survive it. Now, this pragmatic approach is also extending to triaging, prioritizing patients based on the availability of resources and their chance of survival, which, is really necessary in a country that is, suffering not only from an acute shortage of healthcare workers, but also facilities and resources.
Yeah, so these efforts are just astounding. I mean, the bravery of the people that are putting themselves in danger because they can be targeted too. I mean, they're having to wear masks and go in and out of these places just to teach other healthcare workers how to do these things. It's amazing. I really urge people to read this New Yorker article, and we can provide a link for it because it describes the bravery of these people that are going and try to provide care. But that's just what's going on in Syria, the people that are left there. The other issue is how health is affected by the crisis within the refugees, those people that have left and gone to other countries to find refuge.
Absolutely, Jess. I mean, let's not forget the refugee crisis. It's leading to a health crisis of its own. There are over 12.5 million Syrian refugees who have been displaced from their homes. They're living in refugee camps in overcrowded conditions without proper, sanitary or hygienic facilities, which is leading to emergence of full-fledged outbreaks of diseases like cholera, scabies, hepatitis A virus in camps across Jordan, Lebanon, Turkey, and Iraq. And Jess, you actually mentioned Aleppo earlier. There is also the case of Aleppo Evil that's been on the rise in the region. And do you want to kind of talk a little bit about that?
Sure. Yeah, I remember telling you about that. And that was something that NPR covered. Now, the Aleppo Evil refers to Leishmaniasis. This is a parasitic disease that is spread through sandfly bites, and it leaves skin lesions on exposed areas like the face and the hands, and they can scar, and they're also very disfiguring, and it's not fun. Now, this disease is endemic to the region, but it had been relatively controlled until the conflict, and it's now making a comeback, sadly. Between 2004 and 2008, there were 23,000 cases in Syria. Now, it's estimated that there are hundreds of thousands of cases or potential cases the people could be affected by it in Syria, but not just in Syria, also the surrounding region. So the fact that this is something that used to be controlled, but now there's an outbreak going on, there's also a fear that the outbreak could be getting out of hand and could be spreading further.
Wow, that's really sad as well, and it's a very disfiguring disease, as you mentioned, Jess. From what you're telling me, it kind of there's a clear need for surveillance and control strategies to be applied for the refugee population in the recognized camps. But the dynamics of the conflict in Syria, the disregard for civilian safety, targeting of health facilities and healthcare workers, that is like a major blockade on how what is possible for surveillance or prevention. And obviously, lack of access to basic healthcare and malnutrition. I mean, this is a time of fasting. This is for a lot of Muslims, but the hunger and fasting is different. People in Syria, they have a lot of food insecurity issues as well. So that's again a major concern. One more thing I kind of wanted to touch very briefly is we need more donor funding. I mean, obviously there is an urgent need for financing for addressing this refugee problem. And I actually remember reading that UNHCR released this report that they talked about, for the Regional Refugee and Resilience Plan, the 3RP. And it said that only 30% of the required $4.5 billion to address this problem have been achieved so far. So major need there, definitely an important topic that we hope in our own way we can facilitate people to talk about.
I totally agree. It's heartbreaking. It really, really is. And I'm glad that we're just able to bring it up, and so people have an understanding of the problem beyond just the conflict and the fact that this is going on. I think people think about that. But the fact that healthcare workers are being targeted and that this is a strategy of war for the government, and like you said, it is completely against what is okay to do, by the UN, and nothing's getting done about it. And like you said, I can't even imagine, no, how are you supposed to get people to volunteer knowing that they could be targets? So it really gets me. It really gets me. So I'm glad that we're talking about it.
Definitely. And in the end, as long as the conflict would continue, it would impact the health system. It would impact the health outcomes and the whole generation of Syria.
And Souls, and I think, like you said, it's the fact that it's not just the Syrians, it's the neighboring countries. So it's like, as we talk about with global health, health has no borders, disease has no borders. And that's why that's why it's important.
Absolutely. Great point, Jess. And on that note, we're going to wrap up today's episode. Please tweet at us. Our handles are there, and you can also tweet at us at Twig Team, Twitter handle. So definitely write to us. Let us know what topics you'd like us to cover, what you liked about the show, what you did not like about the show. And that's all.
Oh, yeah. And then you can find us on our webpage, twigh.org. And like Solzhen said, we got Twitter, we have Instagram, we have a Facebook page. Look us up all there. Interact with us. We love hearing from you guys, and we hope that we do.
Absolutely. Okay, take care. Until next time. Bye.
Bye-bye.